Hello and welcome to the Master of Rehabilitation Technology webinar discussing career opportunities in patient care. I'm Nicole Skelly Fitzgerald, the Director of Recruitment and Enrollment for the University of Pittsburgh School of Health and Rehabilitation Sciences, and your moderator for this evening. Before we begin, I ask that you mute your microphones, and if you are comfortable, turn on your cameras. It is always nice to be able to see who it is we are speaking with. Here's a brief look at our agenda for the evening. We're going to start off with a few wise words from our guest speaker. We have a few questions to launch our discussion, and then you are all welcome to chime in with questions, thoughts, or comments. Then we're going to move into a short overview of the MRT program, where we'll tell you a bit about how we prepare students to move into these fantastic career opportunities. Finally, we're going to wrap it up with a little Q&A session where we will help answer your questions about the job market, the program, or kind of whatever's on your mind as far as this career path goes. Now, without further ado, I am pleased to introduce you to Kyle Walker. Kyle is the Vice President of Rehabilitation Program Development with VGM Homelink, where he works with stakeholders to develop service offerings and partnerships for rehabilitative services. Prior to this role, Kyle led the operations and development of the assistive technology teams in workers' comp and commercial business lines. Hi, Kyle. How are you this evening?
Doing wonderful, Nicole. Thanks for having me.
Would you tell us a bit about yourself and how you found your way into rehabilitation technology?
Yeah, you bet. Again, super excited to be here. Depending upon how all this works tonight, the audience members, I'm an open book. So if you guys have questions for me, there's hardly a topic that I don't feel comfortable talking about. So so just a little backstory about myself. I live in Eastern Iowa, from the Midwest. Born and raised for the most part. All my family's in healthcare. So my undergraduate degree is in kinesiology and health from Iowa State University. And I'll be transparent right now, coming out of college, it's kind of scratching my head like, what the heck do I want to do with my life and my career? So first job out of college, I was actually a personal trainer in Omaha, Nebraska, pretty decent city. And it was okay. And just kind of started going through some things and said, okay, what do I really want to do? What am I passionate about? And that passion was surrounding, patient care and helping the less fortunate than myself. So backstory, as I said, my family's in healthcare. So my younger sister, she went to school. She's a doctorate of occupational therapy. She works in pediatrics. My older sister is a nurse practitioner, family practice doc up in Twin Cities, Minnesota. My mom was a nurse by trade, but different director roles. And the last role she had before she just retired was in PM&R. So for those of you that are not familiar, physical medicine and rehabilitation. She oversaw a hospital-based clinic as well as several outpatient therapy clinics in Eastern Iowa. And then I say my dad's kind of on the end of the spectrum. All joking aside, that's serious. Life insurance. So again, that's the end of the continuum, if you will. So he's the stretch out of all of us. So getting back, I want to say, okay, what are my career goals? What am I trying to do? And there's an opening at our local hospital-based DME, durable medical equipment provider, home medical equipment, for essentially a service technician. I didn't know a whole lot about it, but I knew I liked to work with people. And so I started working in hospice care for entry-level DME type products like nebulizers, beds, walkers, commodes, all that jazz. And my boss at the time, awesome gal, she said, Kyle, you've got a background in essentially exercise science, kinesiology. You ever think about rehab sciences or a rehab tech? They call the rehab specialist. What's the position? I said, I don't really know what it is, to be honest with you, but sure, we'll check it out. And so there was a gentleman that was in that role for a long time, and he was nearing retirement in a couple of years, and I shadowed him for a couple of years and fell in love with it from the get-go. I remember one of the first times, and I'll tell you more about what that is here in a second, but one of my first appointments that I went to with him was at a children's hospital here in the area. And it was a little girl. She was about 4 years old. Had I think it was kind of, I don't know, some sort of as a chromosomal disorder, some delayments and some cognition as well as physical abilities. Long story short is with the awesome therapist and seating specialist I was working with, we were trialing her in a power wheelchair, really, early intervention. And she starts driving all over the place, going in and out of, that's on her own, just like that. This is like a sweet, cool situation. Her mom's in tears, just bawling. And this girl's got the biggest smile on her face. And I'm over here in the corner, like, I'm not sure what this is or what's going on, but this is pretty cool. So that's kind of how I got into the field. And actually, I think for a lot of us in this field, we never intended to get here, and we would never change it for the world now. So that's kind of how I got into that. And I practiced, as Nicole said, I don't know if you said that in the intro or bio, but as a ATP, assistive technology professional, for about 7 years in this hospital-based clinic. Oversaw all their complex rehab, spent a lot of time at the hospital on their neuro rehab unit. And then about a quarter of my business was specifically in pediatrics. So that's kind of where I got my start. So Nicole, I don't know where else you want me to go from here, but I'll turn it back to you. So
Sure. So it's so funny that you say that, because I hear the same thing over and over again. It's like I had no idea that this is where I was going to end up, but this is exactly where I was supposed to be. And I love this and I wouldn't change it. I hear that from so many people in the field.
That's why I'm so excited to be here. So for you guys interested, even in this, and this is a very broad, it's niche, but it's broad. There's a lot of things we can do. I think we might talk about that tonight too, and some of my experience as well. But yeah, I wish I would have known about this even at an undergraduate level. I would have been in it from the get-go. And you don't know what you don't know. So I'm going to chalk it up to that, and I think some of these grassroots efforts we're working on with you guys at Pitt and some other stakeholder organizations I'm a part of, help get exposure to what we do and why it's important to the marketplace. So
let's talk a little bit about what you're doing now. What does VGM Homelink do? How did you land there?
Yeah, that's another great question. And if I talk too much at length, please stop me. I can be very wordy sometimes. I'm passionate about this, if you could tell already. So when I was practicing at the hospital-based DME, I had some lackluster leadership, to be fully transparent. And it's not to think like I'm like, really highly educated. Like I know a lot of folks within Pitt are PhDs and that kind of stuff. I'm not that kind of a guy, but some things that you're just like, no, I feel like if I was in that shoes, I would have done things differently. Well, and it kept happening, and I kept saying, you know what, boy, I would love to have the opportunity to make some decisions and affect more lives, have more influence, more scope, all the above. So at that time, I was probably in my early 30s, and I was married, had 2 kids, and was having dinner with my dad one night in town. And I said, I've considered, going back to my master's degree. And he said, do it now, because life's not going to get any slower. It's going to get busier. So lo and behold, I did. I went back actually through Purdue University and got my master's degree in healthcare administration, upon which I immediately started looking for opportunities. Not to say I didn't enjoy the job. I really enjoyed working with patients in the field, in the communities, in the hospital settings. But I thought I had the ability to affect more lives, not only from the teams I worked with, but also the consumers in the field and lots of different capacities. So I'm a part of a company called the VGM. It's a Van G. Miller Group. So I'm going to give you the nutshell overview, high level. So this organization is a member services organization for post-acute care. So essentially out of the hospital, providers all across the country, primarily focusing in DME and prosthetics and orthotics, or per Medicare, they call it DME-post type services, So anything outside of that hospital setting to keep them happy and healthy out of the hospital, So a lot of those home medical equipment companies, DMEs, they're a part of our organization at VGM. We have about 25, 26 different businesses underneath this VGM umbrella, and Homelink is the one I work with now underneath this umbrella. Historically, though, we support those providers across the communities all across the U.S. To help them with education of their staff or the clinical staff for CEUs. We provide them with governance and regulatory help, reimbursement help, contracting with insurance payers, as well as we have a unique role where we have relationships with manufacturers of products and services as well, which brings value to that membership to help compete with maybe some national providers. So a lot of these are local independent providers all across the United States. That's the company as a whole. Now I work with the Homelink group, which we are a national ancillary. I'm gonna throw some titles out there, guys. And again, if you have questions to ask, national ancillary service provider, primarily focusing in workers' comp care coordination. So I'm going to pause there and say how I got there. So after I got my master's degree, I have actually been a provider, a member of this VGM group for years, and attended these conferences. They put on conference. Actually, this week we host our annual Heartland conference and we did proper distancing and masking in light of COVID and all that stuff. But hundreds and thousands of people, not hundreds of thousands, but probably thousands of people come from across the United States for a couple of days to partake in networking festivities, education. And I spoke at some sessions on assistive technologies. So anyway, so I've been a member for years and attended this, and they're just, so I live in Cedar Rapids, Iowa. They're based out of Waterloo, just an hour north of where I'm at. And I always said, if I had ever opportunity, man, I should reach out because I know this stuff. I'm passionate. Lo and behold, and I was like, you know what? I'll just reach out and let them know who I am and what I'm trying to do. And I think I sent them my resume and said, hey, I'd love to talk to you about my career plans. And I got an email back like half an hour later from Greg Packer. He's the president of US Rehab, which is a member community underneath this group with complex rehab providers that provide high-end mobility equipment for patients. And we talked, and over 2 weeks, one thing led to the next, and I was there. And about a month after that, so when I onboarded, so I work with Homelink. So I started overseeing the operational teams, as Nicole, you alluded to earlier, of complex rehab technology, which is your high-end mobility equipment. And that evolved even further to encompass prosthetics and orthotics. And then transitioned over the last year now to oversee the development and relationships, I would say, with stakeholders in everything rehab. So at Homelink, if there's an injured worker in the community and we're contracted with that insurance carrier, they will hire us to facilitate and coordinate care for that injured worker. They're a patient, right? And that can be anything from transportation to diagnostic imaging, x-rays, to complex rehab, prosthetics, or placement and care coordination at high acuity rehab centers, inpatient rehab centers all across the US. So I oversee a broad scope now of those kind of operational teams, and just really developing some of our programs to allow the best possible outcome for that patient. We want them to get home. Again, it's probably going to be in a modified way of life post-injury. Yesterday they were climbing up a 25-foot ladder and fell off, and now they're C-level tetraplegic. It's life-changing, and we really try to humanize that and understand what that's like, and hopefully with the relationships and programs we have, help affect their lives. So that's that broader scope I've been looking for, and have the opportunity now. And like I said, doing something like this, I love advocating for the communities. And I'm a part of a couple different organizations across the United States, like University of Pittsburgh's MRT program. I sit on a couple of national boards with RESNA, which is the accrediting body for my ATP credential, professional standards board, and then some fundraising boards. Again, very passionate about this and want to continue to affect those lives are less fortunate, and open up those doors to their mobility and their, extension of their body, their legs that they're maybe not afforded to, because of these situations. So very long-winded, Nicole. There's my answer for you, how I got into the field. So
you just mentioned your ATP credential. We know what the MHA is. We know what the VP is. For those of us who are less familiar with the acronyms, what is an ATP and what do they do?
Yeah, that's a great question. So the ATP is an assistive technology professional. That's their acronym, ATP. Okay. So the ATP, and I'm going to reference, I'm not going to get too in the weeds with this, but I'm going to reference Medicare. So in the post-acute world, even in health insurance as a whole, Medicare is a primary payer. Most providers, I would say on average, it is anywhere from 50 to 80% of their business is in Medicare. So I say that because it's based upon policy. Okay, so an ATP per Medicare has to be involved in that provision of that intervention or product on the CRT side, which is complex rehab technology. So for those of you maybe not familiar, A complex wheelchair would be a high-end manual wheelchair, very lightweight, that allows the patient to be mobile and independent. Or on the power side, it could be a high-end power chair that tilts, reclines, allows them to access their environments. So for Medicare, an ATP, a credentialed license, not a license, that's a certificate credential course, allows me to work with those individuals, given my background, education, and field experience, and then allows me to again help facilitate those requests with a care team of PTs and OTs, physiatrists at the PM&R clinic, and speech language pathologists. It allows me to help obtain and acquire that technology that end user needs to communicate, to do their ADLs, or activities of daily living. In our world, we say MRADLs, mobility related activities. Everything, and again, not knowing you guys from the half down, I always hear it, but maybe your legs don't work, to allow you guys to walk to the store, to go to the mailbox, to go to the bathroom. That's what this technology is. Very assistive tech is a very broad topic, and allows us to be able to work with that. And there's just like any other credential, I have to get certain contact hours every year for the latest research, education, keep my skills up to par. So long-winded answer again, Nicole. Does that answer your question about an ATP?
It does. It does. So a lot of the programs
Yeah, that's a great picture there.
Yeah, so a lot of the programs in our school are working with people to help them, do the things they want and need and are expected to do as independently as possible. And the ATPs are really bringing in more technology to that process when it's needed. And so I've teased this session by talking about high demand. There's high demand for ATP professionals. Could you tell us a little bit more about those current needs?
Yeah. So, your slide says that the need for ATPs, we are in a big need, guys. And this is why. And yeah, I'm biased because I'm an ATP and I love what I do. But anybody that loves working with people, that loves technology, that loves all of that, would probably be a great fit for you. So a couple of reasons. Obviously there's not always just one reason. There's multiple facets to this. One is our population as a whole. So you all are aware our population is aging. Baby boomers increase, and their need for independent mobility continues to increase. That's one reason. Again, I probably have 10 fingers held up by the end of this. Second reason is so our population's aging, but very closely related to that population, the ATP pool population is aging as well. Now, this article or study that I had seen is a few years old, and I want to say maybe it was 2018 plus or minus a few years. I want to say, Nicole, if you've seen this, correct me, but the average age of the ATP in the United States is like 54, maybe even older than that. Okay.
Yep.
Now I bring that average down quite a bit, but let's look at the next, and even with the public health emergency, COVID-19, I'm sure some people have had retired early. The next 5 years, that average age is 60, and guys' retirement age is right around the corner for them. Now, for all you guys look really young, which is great, but the need is going to be there, and the need for healthcare providers to have these credentialed staff, and can pay very well to have these as part of their scope of services. There's a couple other things that I think I want to mention too, depending upon your familiarity, is there's over the last, what's probably been longer than I'd like to admit, but at least the last probably 5 to 10 years, a big push for care in the home, outside of that acute, that in hospital type setting. From an insurance perspective, it's very expensive. Okay, so health systems, organizations, insurers are continually be challenged to how to provide that care outside of that hospital setting, how to provide care in the home, let alone the consumers of these services want to stay in their home, want to age in place, if you've heard that terminology before. Okay, this ATP will help allow our communities and the members in those communities to age in place, to stay in home, to stay safe, looking at not just the equipment, but their home environments as well, and access to their environments. The other one that actually University of Pittsburgh's done some research about 15, 20 years ago with the VA relationship in telehealth. Okay, we saw a huge adoption of that this last, and I hate to say this is crazy. So come spring, it'll be almost 2 years now. This COVID-19 stuff, which is crazy, but a huge adoption in telehealth, telemedicine, virtual services. Now we've seen a decrease in that as we get more back to normal. But I actually just hosted a session at this Heartland conference I was alluding to in the panel session. So Dr. Schmaler from Pitt was on there with us, and we were saying, okay, where's telehealth? We had some insurers, big insurances companies in the United States on this panel say, is telehealth here? And it is. It's going to stay in some capacity. And we continue to challenge the status quo and the way of doing things to provide access to healthcare services to individuals in rural environments. I live in Iowa. I could go 5 minutes down here, be in a cornfield. I enjoy that piece, but anyway, I mean, people need access to care, and telehealth and virtual services allow some of these. And even in a clinician's world, so I work very closely with care teams of PTs and OTs, physiatrists, and other docs within that setting. Traditionally, they're in a clinic setting. A lot of times they don't get out into the home. And so having these services allows these clinicians and teams to see through this proverbial window into the patient's home. A lot of what we do is based on Medicare or insurance policy, Nicole. So, and these policies say, well, we have to evaluate in the home and home functional mobility. Well, I am an ATP, I might see the home, but the clinician won't. So how do we access that? And through some of these virtual services. So I think there's I think there was only 4 or 5, there weren't 10, but those are 4 or 5, I think, really important issues that we need more ATPs in the field. And guys, gals, I apologize. There's a guy on the errands there. You know, there is a need now, and it's a skill set that no matter where you go, there is always a need. I challenge you tonight after this, Google or go on Indeed and type in ATP. I bet you $100 you'll find one within 30 seconds. Now you may have to travel a little bit for it, but wherever you go, there's always going to be a need, and it is so valuable. I'm sorry, I get passionate about it again, but yeah, no, I love it.
So why, I mean, you're sharing your passion, and I think you're really kind of giving this answer already, but why should a prospective student, regardless if they're more of a traditional student or mid-career professional, want to study MRT or rehab technology? What makes this a good career? If you could sum it up, because you've talked about it a lot.
Yeah. And I think I think it'll go back to what that candidate is passionate about. And to be fully transparent, depending upon your guys' age, you may not know what that is right now. I'm going to step away for a second and come back to this, and it'll make sense here. And I'm talking about passion, and then we'll connect the dots here. So there used to be a group of guys that I used to follow on a podcast called the Minimalists, talk about living life with less, and they talk about using things and loving people, because the opposite never works. Well, anyway, through their podcast, they always talked about values, and for years, I listened forever. They used to talk about this, and finally, I'm like, okay, one day, what are my values? Who am I as a person? What am I passionate about? So I did this little online test or I don't know, kind of a quiz, and I identified some of those. And one of my core values is contributing to the greater good. Okay. So when I had identified that, I said, okay, in my role and capacity, what do I have the most opportunity to do that? That's part of the reason I went back to my master's program, to have more influence. Within a master's level program, like at Pitt I'm going to be biased here, probably the best in the country when it comes to rehab science and technology, guys. And they're not paying me, so I could say whatever I want, just so you know. It opens up so many doors. Okay, it's taken that bachelor's degree to that next level. Again, there's still a broad array of things. In my capacity, I touch clinical services. I still work with patients in the field from time to time. I lead teams. I enjoy that aspect of things and helping develop others in their skill set, identifying their passion, and then that downstream effect is affecting the lives of the consumers we work with in the communities. I get the opportunity to work on contracting, business development, and finances, looking at how insurance policies affect the end users in their life. There is so much here that this master's degree allows you to now say, okay, I've got some street cred, guys, for the technical term, right? But But in reality, it allows you to think critically, to think, okay, what's my scope and exposure? Maybe it is technology. Maybe it's bringing a new product service to market. Looking at all the ends of what my referral sources or revenue streams could be, or maybe it's on the advocacy side from governance, from a state level, from Medicaids, or even a federal level from CMS, or any other insurers. There is so much that this program will allow you to do, and it'll be so valued. Just the name of University of Pittsburgh alone has a lot of weight to that, or clout, if that's the right word. So I would highly implore you guys, if this is something you're looking at, there's so many different avenues you can take. So I don't know if that answers your question, Nicole.
It does, and a little bit more. So we're talking about patient care career opportunities. What does that day-to-day look like for someone in rehab tech who is working with patients?
Sure. And so even though we're talking about this niche kind of industry, it is still very broad. So I think it depends upon what your role and capacity is within even that kind of subset, Nicole. So let me give an example. Let's say an ATP that works as part of, and an ATP can be a rehab professional. They could also be a clinician. Okay, so let's say not the clinician. So a clinician might work at part of a health system, whether it's in a PM&R clinic, or an outpatient therapy. Let's just say this is a ATP working as part of a home medical equipment provider. So that day-to-day might look like part of that day is spent helping on authorizations through insurance, let's pause. Let's back up. Let's kind of go in a circle here. So part of it might be, hey, I'm working with now a therapist at the rehab clinic because we have a patient come in that, let's say, has been recently diagnosed with ALS, Lou Gehrig's disease, very progressive neurological condition. Okay, we know there's empirical evidence out there that says the progression of disease, it's going to affect their body, and it's not going to be a great outcome. But they still may have a few grand years to live, and we want to allow them to be able to do that. So I'm going to work with that clinician and help evaluate them based upon their needs now and what that prognosis is going to look like over the next 12 to 18 months. So we're going to evaluate them, look at their home, and then I'm going to work with my team in the office to get quotes from manufacturers and specifications. I'm going to use my measuring tape on that patient, feel their bony prominences on their hip with the PT and OT to see how they present now and what access they need to different things. And this condition, so when we think of assistive tech, it's AAC, augmentative and alternative communication devices too, and drive controls. This is the cool stuff. This is the tech stuff that I kind of geek out on. Give me just a second here. So and I say this with all due respect, because this is a terrible situation for anybody to be in from the patient standpoint. And that's where I think I bring value to help, accommodate those needs where they're at some of the most fragile times in their life. They may have the progression that they're not going to be able to use their arms and hands. So they have to maybe drive with their head, or you've probably seen, you guys know Stephen Hawking, not with us anymore. Great example of a gentleman who uses a speech device to communicate. They have technology coming out now, which is, I think it's really just emerging, to drive through your eyes. It has a camera and you can track, and it will drive for you if that's the only movement you have. They have predictive analytics as part of these software programs that it has a screen maybe in front of you, and you can select with your eyes, and it'll recognize somebody's face, and it'll auto-populate a script to say, hey, do you want to say good morning? And you like wink, and it'll speak for you. I mean, this stuff is endless, guys. All right, so I'm getting off topic here. Okay, so that was the tech side, but day in the life. So I'm involved with the evaluation, getting my quotes, getting authorizations through insurance, and then I get the privilege to provide it in the home to work with that patient, their family, and I've had the privilege to do repairs too, as the stuff sometimes breaks down, to make sure they have their equipment up and running, so they can think about their chair doesn't work and they're a quadriplegic, right? None of their arms or legs work, they live by themselves. What the hell are they going to do? I can't imagine what that would be like, and nor do I want everybody to ever go through that situation. So a lot of even what I do now is saying, okay, how do we do things smarter? So with telehealth, for example, we can bridge that gap and challenge the traditional mindset to do like a service and repair. We can do stuff virtually through secured platforms and assess that. And some of these chairs, today these guys are connected virtually Bluetooth through different platforms that I can look at the battery cycle and the usage of this equipment. So that might be, as a long-winded answer, but might be one example of what my day in life as an ATP looks like. It could be from a manufacturer standpoint where I'm very passionate about technology, and I think this would really be beneficial for a consumer in maybe in a home type setting. So I may be working with designers to work on CAD designs to bring it to market. I may be working with insurance companies like Medicare to get it coded and get reimbursement rates for that. It could be working in getting this work. Actually, this is a great example. I've got a relationship with a company called Rewalk Robotics right now. And they've got an exoskeletal suit that helps people ambulate given their spinal cord injury. There's research to support ambulation and standing benefits clinically. Long story short is they don't have it approved through Medicare yet, so that's an uphill battle. So that kind of exposure, if that excites you, that kind of front. I guess there's so much, Nicole, what a day in the life looks like. I don't know, maybe gives you a couple insights. So I could talk for hours, so I'll stop there in case you have more questions.
Well, I've really dominated the conversation with questions, so I'd like to open it up. Does anyone have a question for Kyle? And you can type it into the chat if you don't feel like chatting with us or talking.
Oh, thank you for the presentation. What's the difference between ATP and a rehab engineering technologist?
That's a great question. Nicole, I might see if you want to help me out with that. My educated guess from a rehab, what'd you say there again, Mary? Rehab engineering?
Rehab engineering
technologist?
Technologist. Okay. So again, remember, there's lots of broad scope even within this kind of niche community of healthcare. Okay, so my educated guess, Nicole, correct me if I'm wrong, a rehab engineering technologist would be someone that would be designing and implementing products to bring to market or making them better for the end users. Am I along the right lines of that, Nicole?
That would be my guess as well, but okay. I will double check that with our faculty, and I'll send that answer to everybody.
Yeah, that'd be great.
Probably early next week, just to make sure we're not providing any bad information here.
Right. So then and we're comparing it to an ATP then, so I would be the one that wouldn't maybe design the products, but I would use those products that are designed and in the market from manufacturers. I would access them, I would purchase them or procure them, and then provide them to the end user based upon their needs. Hopefully that answers that, Mary. If you have any questions, let me know. So. Peyton, were you going to say something too? I saw your mouth moving, but I think you're on mute.
Yeah, I have a question. So you said that there was like a lot of need for these types of jobs. To want to do this in the future, like what do you recommend us do like over the summers or even in school to prepare us for it?
Yeah, that's a great question. Matt, I ask another question follow up to you, Peyton. How old are you and where are you at on your education path?
I'm a sophomore kinesiology major at Miami University.
Miami, awesome. Okay. So your question was, what should you do like in the summer, like or internships, those kind of things to prepare for that? Well, I guess I already said it. If you have the opportunity, and I think Peyton, and I'm happy to connect you, but I don't want to step on anybody's toes, but with Nicole and Kate here, they are very well connected in the communities across the country. If that might be a resource for you. If not, I highly encourage you to have, even if it's an unpaid internship, Peyton, depending on what your focus is or interest is, I would encourage you to look at a couple different things. You could reach out to a local provider of services, so maybe it's a home medical equipment, and let them know you're interested in the field, and maybe shadow an ATP for a day or a couple days a week to see what they work with. And you got to understand, as I was saying, those ATPs, they may have a focus too. Some may work primarily in pediatrics. Others may work in specific populations like an ALS population type. Others may be more geriatrics. Okay. So I would encourage you to do that. I might also encourage you to look at the clinical side. So kinesiology, great. I've got a lot of buddies that went and did that for pre-med. So if the clinical side, the physiatry type side is more interesting to you and brain injury, I mean, there is so much to do. I would encourage you to reach out to your local health system or a hospital in your area. I don't know one that doesn't have a volunteer type program, or if they don't, they'd be dumb not to. So I would encourage you to reach out to them to just shadow. We've got a program here locally. We've got students coming in all the time. Again, just checking things out. Those are a couple things in person, in life, in respect to COVID and those kind of things. There's a lot of resources out, even virtually, that from podcasts to webinars. I'd be happy to follow up with Nicole that she could send out some links to even stuff that I've done before. Just, thought leaders in the industry, talking about these kind of things. There's even industry magazines. There's one called, I don't have it here, Mobility Management. It's a free magazine that all they talk about is ATP jargon and wheelchairs and all that stuff. It's free, and you go, you Google it. It's on there. So long-winded answer, Peyton, but yeah, I would try to. If I could do things differently, I would have got so much more volunteer experience just to job shadow, to try out all those different things. So hopefully it answers the question for you. And after this, I don't know if my contact information is provided. I can be a resource for any of you guys. Reach out to me. Tell I love this stuff, and want to get more individuals in this marketplace. So I'm happy to help any way I can.
We can certainly share your contact information after the session if you're okay with that. Absolutely.
And I'm on LinkedIn, so I don't do Facebook, TikTok, Snapchat. What's the other one? Twitter. I don't do that, but I am on LinkedIn. So follow me on LinkedIn. Actually, I put a post about this, so I'm glad you guys are here. Maybe you saw it. But follow me. I put a lot of relevant information, whether it's research or thought topics on there. So love to connect with you there too.
Fantastic. I know that we had a recent student that kind of found the field through their work with adaptive athletics. They worked with an adaptive rowing team, and kind of found the field and wanted to get more involved, and that's how they found our program. So there really are so many different avenues.
That's a great timing. I mean, right? I don't know if it's still going on, but the Paralympics right now are going on. If any of you saw that, holy smokes! You talk about a gifted athlete, regardless of if they have a leg or not. Or I saw this. What was it called? I don't even. It was like soccer, but for blind individuals. They have this, and they roll this ball in this huge net. I had never seen such thing. It was so cool. I mean, that's what we talk about assistive tech. Just keep it high level. It's anything that helps somebody accomplish their daily tasks. And it could be technology. It could be a service. It could be a hardware type device. Rancho Los Amigos, I follow this guy, Andy Lynn. He's 3D printing stuff for all the time. Like, guys, it could be anything. So anyway, sorry. Got on topic there. I do that.
Any more questions?
Yeah, I don't.
Yeah. Oh, you can go ahead first.
Okay. Yeah, my name is Salah Al-Qahtani, and I'm working currently toward my PhD at Rehabilitation Science and Technology. And yeah, I'm wondering, well, like, what options are available for people who hold such degrees to work in the United States, other than like the research or academia, fields? Do you have any suggestions?
Well, how do you pronounce it? Was it Saleh?
Saleh, yes.
What is your focus with your PhD right now?
I'm focusing on developing the research, like future research area regarding the mobility devices.
Okay.
So I'm basically identifying the different opinion of people with disability who use mobility devices around different countries to grab their opinion about the future area of research.
So on that, now this is my educated. You've got more education than I do already, so I'm going to try to fill in the gaps here. My first thought would be if it's on research on product and mobility type equipment.
Mm-hmm.
There are so much opportunity. When I'm going to talk about the manufacturing side, and I've got relationships with some of the biggest manufacturers all across the world. They are continually to say, how do we do this better? Is there another product that is, whether it's an efficiency standpoint, more access, more clinically sound to mitigate decubitus pressure ulcers on their seating surfaces? How do we bridge that gap? That's an opportunity that is always going to be there on the product development side, or bringing new products to market. There, I mean, like I referenced that Reebok Robotics, there's other exoskeletal companies too. That is a tech that is continuing to emerge, and my educated guess, in the next 5 to 10 years, there'll be a CMS approval for something like that. The other things in the neuro space, depending upon your scope here, is even Pitt's done some stuff years ago where they're starting to, there's a book called, if you want to read a book called Live Wired, fabulous book, talking about the neuroplasticity of the brain. But there's so much opportunity to actually harness what's happening in the brain to then translate that to movement of a robotic device, or to access different technologies. That is really starting to take off. The Madonna Rehab in Lincoln, Nebraska, some of their researchers are working on some of that. And then what's that translation to a product to then have application in the community? So there's a couple opportunities. Nicole, I mean, with you guys at Pitt, you guys do a ton of research too. I know a lot of the guys in your HURL lab with the VA, that there's stuff there. I don't know if you could provide any high level feedback on what opportunities with his PhD focus as well.
Yeah,
I would say definitely reach out to us, and I'll connect you with the faculty. There's so much going on within the program and within our human engineering research lab. There's so many connections into various hospital systems, including the VA hospital system. There's a lot of opportunity for sure.
Yeah, you mentioned so much of what we do, guys, in this space is based upon, and I keep saying it, not in a bad way, it's policy, right? This stuff's expensive from a product standpoint, if that's what we're looking at, even technology. So most times to get this funded, it's through an insurance type plan. So that's why you're referencing most insurance plans outside of work comp, which I deal with. It's a crazy beast within itself because there are no policies, but it's follow the policy based upon medical necessity, okay, and approval and reimbursement rates. There is so much that it will continue to evolve on that front. So that's a huge space as well. What else? This is great. Keep them coming.
Yeah, so I think you mentioned it earlier about your relationship with manufacturers and how these manufacturing companies are continually like trying to improve their own products. What is your relationship with wheelchairs? Have you ever felt like, oh, I feel like this is something that could definitely improve these wheelchairs? Have you ever like gone to a manufacturer and been able to have this conversation on ways to improve it?
I have. Now, yeah, I think there's a lot of answers to this question here. One is I would encourage you, and do you pronounce your name Ariba just like it looks?
Yeah.
Okay. So Ariba at Pitt, they have a lot of, actually they do research all the time on product specifics. And I'm gonna get really granular for a second, but on the wheelchair, like a traditional wheelchair, the small wheel is called a caster. They do research on essentially the durability of casters in the marketplace on the manufacturer's chairs. Okay, that's very granular. That's very focused. Okay, and how to improve that, right? Because at the end of the day, we want to make sure this product is as durable as possible, given the need and environment of usage for that patient, right? For the consumer, okay, for the client. So a lot of times, I'm very privileged and I get the opportunity to review scientific papers as part of RESNA and provide feedback to students who are doing research. I also have the opportunity with those manufacturer relationships. They will engage us. Actually, this week at this Heartland conference I was alluding to, there's a, I don't know, Nicole or Kate, I don't know your experience. If you remember any wheelchairs back in the day, E&J, if that name rings a bell for you guys, I don't know how old you guys are. Old manufacturer, used to do a lot of products and kind of phased out, okay? Well, they're starting to come back now. And as part of that, we had a small cohort of say, hey, this is kind of a new product. What are your guys' thoughts? So often, Ariba, they'll engage and actually they hire clinicians to look at this stuff. They'll hire end users, consumers of these products to get some feedback. So yeah, I've been very privileged to provide some of that. I think it's a way for them to get free feedback because I don't bill for any of it, but I like it. So I'm going to provide my feedback. One this week was, There's not. So this gal in this pic, you can't see me pointing, but and if you can see the screen, the young gal in that kind of that teal light blue chair. So that's just a normal K5 is an ultra lightweight wheelchair. But there's some that tilt back to relieve pressure. But a lot of it's attendant driven. So your caregiver has to do that. Well, this chair had a, I guess, self tilt, so they can tilt themselves back. Might not mean anything to you guys, but the level of independence is so important for some of these individuals. And I just thought it was the bee's knees to allow them to do it. Now, I did provide some feedback on their leg rest. So they'll just, for example, their leg rest elevated, but it didn't articulate, it didn't come out. And I personally had experience with some of these leg rests. So when you do that, guys, if you have any physiology background, your knees are going to bend and it puts more pressure on your ischial tuberosities, your pelvis area. Well, it's not real good. So I highly encourage them to have an articulated platform as that comes up. So anyway, yes, love providing that feedback because again, it's what's real world applicable, right? What they see in the developmental clinic and actually what's happening in the community sometimes are two different things, right? So yes, we do provide that feedback and enjoy doing that. So great question. Sorry, I was long-winded again. What else?
How were you able to get your hours for the RESNA exam? And how
Yep.
did you prepare for it?
Yeah. So two questions. One, before I actually took my ATP exam, so I'm going to reference Medicare. So I could work with certain products of mobility equipment, but just not the CRT. So CRT is a complex rehab technology defined by a certain set of sensory codes. I'm not going to get into it today, okay? But I could work with equipment that was not the CRT before that to get those contact hours, okay? So I did that as part of the organization. And I would encourage you guys, depending upon if you guys, I made a deal, I negotiated, maybe that's why I'm in a business type role now, say, hey, I will sit for my ATP exam. I want you guys to pay for it for me. And I said, hey, if I fail it, I'll pay for it. I'll reimburse you. But if I pass, you guys are paying for that in my certifications going forward, my renewals. And I passed. So I tell you what, I was probably not the best undergraduate student. Let's be honest, okay? I'm a real person. I studied more for that exam than any test I have ever taken before. It is difficult. It is a lot easier if you have a exercise science like kinesiology, physiology type background, because a lot of it's clinical, those questions. And there's a fundamental reason for that, because you're working with the human body, right? You're working with a person, and then it then starts bridging the gap into the technologies that we have access to. And a lot of that test is looked at communication type devices and programs and different methodologies to access some of that. So, there are resources in the communities, Mary, for prep courses for that exam as well. And I'm sure Nicole and Kate can connect you with those as well. So I can be a resource too, but it's been a few years since I've taken it. I've heard it's gotten harder since I took it. So best of luck. All joking aside, I'm sure you'd be fine.
Yeah, so in addition to that feedback, the Master of Rehab Technology program at Pitt really prepares you for that exam, the content on that exam. And then in order to sit for that ATP certification, you need a certain number of clinical experiences. You need time spent with patients in order to even take the exam. The didactic education, the lectures and the skills labs that you complete while you're in the program help decrease that number of hours that's required. And then while you're in the program, you also earn hours. There's required.
So they're a step ahead after they come out of this than I was. Yes. Is what you're saying.
Oh yeah.
Oh, great.
Yeah. So
wish I would have known this before I got into it. So
you earn a bunch of those hours through the internship in the program. And then because it's an accredited master's program, and you've got a certain number of credits complete through that accredited program, the number required drops. So it's very little that you would need to do on your own. And oftentimes students are completing that, during their internship. They're not doing the minimum in the internship. They're doing a little extra. So,
and Nicole, remind me, is there something, is it with this program or even this undergraduate program at Pitt that does a mentee apprenticeship type thing with RESNA? Am I on the same page with that? that you could, I
I'm
don't know.
not sure. I'm not familiar with it, but I might just
If I
not.
find it, I'll send it to you. Then you could
Okay.
disseminate it. But
Will
maybe,
do.
yeah.
I'm graduated from a Master of Rehabilitation Science from Pitt back in 2011. So
Oh, you are?
yes.
Oh, that is so awesome. Look at this. We got a grad on the call. That's great.
Yeah, I'm doing also my PhD now at Rehabilitation Science in Pitt. So
Oh,
yeah, I'm totally familiar with the course itself, and I think there is like kind of internship. It's a mandatory for every master student to have it, so that would help you out to prepare for the ATP exam. So that's kind of things to keep in mind.
it's like, can tell me, where did you do your internship through, or what organization, if you don't mind?
I did it through the CATS. It's the Center of Assistive Technology. It's the third floor and Rehabilitation Science, and I think School of Rehabilitation Science and yeah, SHRS. So
That's awesome.
yeah, it's you have different options to do the internship, even through the CATS, which is a part of University of Pittsburgh and UPMC as well. Also, you have another different options to do it like outside with manufacturers or whatever you selected. So you have different options to do it.
Well, I appreciate that. I'm honored that we have you on the call, a graduate and now PhD student at Pitt. That's awesome. That's really cool. Humbled to have you.
Thanks.
You bet.
I have a question.
Go ahead, Megan.
Okay. So I have a question. I was wondering if you could provide some examples of different companies that hire ATPs and different settings we could work in. I know there's like NewMotion and NSM, and I was wondering what else there is too.
Yeah. Where are you based out of, Megan?
So I'm in Massachusetts, and I'm actually in the MRT program right now. So
Okay. Whereabouts in Mass?
like an hour south of Boston.
Okay, south of Boston. So I actually was just in Boston 2 weeks ago at Spalding Rehab, if you're
Nice.
familiar. So that's a lot of what I do, is building a relationship with different rehab centers, but to the clinical site. So you're not going clinical, correct, or you are?
No, so I have a background in engineering.
Engineering. Okay. So let's see where you're at. So yeah, the two nationals you named, NSM and NewMotion, are two of the nationals, which I know very well. I've got great relationships, think very highly of them. There are lots of independents too. And Megan, what I'll do, if I don't know, Nicole, if I could get Megan's email address, Megan, I could send you a list of a few providers within your kind of area, if you will, and I'd be even happy to introduce you. More than likely, they're part of our membership network too, to look at that from maybe the DME provider. I could also see if there's maybe manufacturers of those entities in your area as well. Yeah, I think we could start there. That'd be great.
That'd be awesome. Thank you.
You bet.
Yeah, Megan, if you are okay with me sharing your email address, then I will send that over.
Yeah, that's great. Thanks.
Now, I know earlier in the session, I said that we would jump into a bit of a program overview, but we only have 5 minutes left, and this has been a wonderful session. So instead of trying to cram in some information, some details about the program at this point, I'm going to share a previously recorded program overview webinar with Dr. Mary Goldberg. She's the program director, and that way you can hear it from her. And we can spend the last couple of minutes here on any final questions that we have. Anything else?
We have a question in the chat from Aaron. And Aaron asks, do you do any home automation work?
That's a good question. I wonder if Aaron, if you can hear me, you're still on there, if you could define home automation work. So in terms of access to that, I don't particularly do that. However, a lot of individuals in our field do work on even home, like I said, access and modifications and technology in homes, whether they're oh, there you go, to assist folks with this. Yeah, okay. Yes, this bill does allow that. So again, whether it's a physical technology, simple things as, you know, ramps and stair lifts, it falls within this scope. Again, assistive tech, right? To technologies and devices that connect individuals to live independently. You look at even like heart monitors and glucose monitors. That's technology that will then interface with different insurance platforms, compliance stuff, as well as some of these chairs will connect Bluetooth to TVs, lights, computers, all this stuff. So yes, there's a huge, okay, here's a plug. There's a huge need in place for in-home type access. So if there's an opportunity and one that's not tapped into very much, it's what you're just asking about, Aaron, right now. And that gets outside of my comfort zone because I don't do that. And I work very closely with a colleague of mine. That's all he focuses in assistive tech in the home. And ensuring that that patient has a safe environment and access to their needs, whether it's modifying, you know, their kitchen to bathroom. Does ATP make recommendations for home tech or a different professional? I think it's a combination. And there's not always the one way to skin this cat in this field, which is good and bad. ATP can absolutely do it. They can start down that road and look at that. Then there's collaboration with that, maybe construction contractor, right? The person doing that, depending upon what that scope is. Okay, it could even be a clinician, an OT that specializes in home assessments. Okay, so there's a lot of scope within that. But again, huge opportunity. We talk about baby boomers; they're going to be in their home, guys. There is so much opportunity there. And there's some real, even like Google and some big Amazon, they're getting into this space too. I'm just so excited. There's so much to do there. So great question, Aaron.
All right, we've got 1 minute left. Kyle, any final words for the group?
Sure. I'd leave you with, again, kind of the fundamental core of this interview is, if you're passionate about providing care to an individual, this is a great opportunity, guys. Pitt is one of the best organizations in the companies to provide you with this education. I know that I've been working with them for years now. They are so fundamentally sound with their education, the topics, the broadness, and specifics depend upon that, with research, with advocacy. This is so awesome to get into. You will never leave, I tell you that. So fair warning, once you get in, it's you won't get out because of the impact you have in someone's day. To have a kid access their environments to run around with their brothers and sisters or roll around, okay? To have an adult going through the hardest place of their life finally be able to drive again in a vehicle, to have somebody in an exoskeleton walk down the aisle with their daughter as they're getting married. Guys, these are stuff that is fundamentally important in our lives, and I feel privileged to work in this field that I can provide that mobility and access to technology and normal care, that without that, you know, they wouldn't be where they're at. So would implore you to look at this program, guys. It's an awesome thing. I'm here for resource for if you have any further questions. I know we had an hour. I could talk for 5 hours about this stuff. Just again, Nicole and Kate, thank you very much for having me. Pleasure to be here with all you guys, and please connect with me. Happy to help out any way I can. So,
and thank you for joining us this evening, Kyle. We really appreciate it.
You bet. My pleasure.